Most Latin American countries have been preparing for virus outbreaks, even pandemics, long before the first case of COVID-19 appeared in China. For years, the Pan American Health Organization has been providing technical support and guidance to the region. But as COVID-19 spread, they stocked the region with testing kits and began training programs for early detection of the virus.
To be prepared means that they should be able to detect the first cases when they have the first cases, but at the same time to prepare their health service, because the stage that we have now can change in days. So one country is receiving travelers that are infected, but they can have at the same time, or even 1 or 2 or 3 weeks after that, transmission in their community. So the country needs to be able to make the shift from the containment strategy to mitigation strategy in a very fast manner. For this reason, we are preparing for today, but also preparing for tomorrow.
Would you say some countries in the region are better prepared than others currently?
Yes, we have different levels of maturity in the region. The health systems are in a different level, so we are particularly concerned about countries that have more vulnerability of their health system, such as Haiti, for instance, or Venezuela, and also in some countries, such as the Caribbean islands, that are countries with a small population. So if there is a cruise with 1,000 people infected, this will be an important burden to their health service. So we are trying to support the countries in different sub-regions in the Americas, looking for their specificities and trying to provide the technical cooperation that they need to be prepared.
Dr. Jarbas Barbosa has enjoyed a lifelong career in the international public health sector. He's held many high-level public positions in his native Brazil, Latin America's largest country. He's in charge of the PAHO core program for technical cooperation with the organization's 35 member countries.
The international health regulation provides a very important mechanism to share information, and I think that it was fundamental during this COVID-19. China shared the DNA, the virus DNA in the first days, so everybody could develop the laboratory kit to test their suspected cases. So this kind of thing is very important because we will have new virus in next years. We don't know when, but we know that this will happen again. And when it happens, we always know that in the first days, first weeks, people are panicking because they don't know what's happening. They don't know the severity. They don't know what will happen with their family, their community. So it's very important a clear communication, message based on the scientific, technical evidence that we have, so that the people can protect themselves, but at the same time avoiding any kind of disproportional measure by countries or by communities.
PAHO recommends following their 2015 international health regulations, a protocol to avoid a regional or even global spread of diseases. The guidelines contain sanitary measures to be put in place at airports, ports, and ground crossings without interfering with trade and transportation.
At the same time, I am concerned that the countries, they need to make the right decision about the strategy. Measures at airports, they are important to share information for international travelers, but they are not 100% efficient to prevent the importation of the virus. So at the same time that you need to provide information at the airport, you need to prepare your health service. You need to have a clear message to your population to avoid the panic, to avoid overreaction, to tell the people how they can protect themselves, protect their families. I think that this is my concern, that the countries make this movement in a very fast manner.
What would you say is your biggest concern as you've watched this all unfold?
I have two concerns. One is what can happen in a country with a very vulnerable health system. So Venezuela and Haiti, for instance, I think that we need to mobilize the international community. We need more resources to provide to these countries so they will have the personal protection equipment to protect their health professionals. For instance, they need to have all the medicines that they need in order to be prepared.
Now, you mentioned vulnerable countries like Haiti. The resources, the people needed, the medical staff to help contain an outbreak. But what about when it comes to the medical systems, the health systems, the infrastructure, hospitals? How can those countries be helped when it comes to the facilities?
Yes, I think that this is a big concern that WHO has. The Director General made a public call, a public appeal for the international community, because if you have a country such as Haiti, that people need to pay to access the health services, many people that are infected or that have some kind of disease, they will not go to the health service because they don't have how to pay. If you have this situation during an outbreak of COVID-19, you have many cases that are not being detected. They will not receive the proper health care, the proper care, and probably we will have severe cases and we will have deaths that could be preventable if we have universal access to primary health care. So this kind of a thing that is important. The countries in the region that have universal access to their health care, that people don't have to pay to have care, probably are much better prepared to face the COVID-19 and to respond properly.
Dr. Jarbas Barbosa, thank you so much for joining us on America's Now. We appreciate it.
No, thank you.